Healthy carbs, we would like to talk about that because people don't know the difference between high glycemic and low glycemic index carbs and what it does to your body. That's number one. I would like to talk about how people think about themselves like, oh, I lost weight, so I'm healthy. Because you can lose weight in many ways. Healthy is a different issue, but people equate, and I think that's like a mainstream culture kind of like preaches that. That if you slim,
that means you're perfect, right?
Exactly.
Right. So we have an expression. It's called a skinny fat person, and it's actually called a TOFI. Thin on the outside, fat on the inside. So just because you are skinny on the outside, that means nothing. I look at your blood work. Your blood work is a mess. Your triglycerides are too high. Your blood sugar is out of control. You are a candidate for diabetes. Your LDL is out of control. So just because you are skinny, that means nothing.
Exactly. It's not because you can put on the nice outfit.
Absolutely, absolutely. So not a marker for health at all. Your other question about carbs is very interesting. Not all carbs are created equal, and not all carbs are evil. Your body needs carbs. Why?
It's the main source of energy.
It's the main source of energy. It's the main. If you take out all your carbs, you're going to be really tired. You're not going to be able to concentrate. You need carbs. Your brain needs carbs.
What do you think about ketosis? Because people they measure it with there's I don't know,
it's a urine stick, yes. Yes.
And then you see the ketone bodies.
You see the ketone bodies, right? Which is a very acidic reaction. Diabetics go into ketosis, right? When they almost go into coma.
Yes.
Right? We see that in the clinical setting, you and I. I have quite a lot of patients who have tried a ketogenic, which is a very high-fat diet. And unfortunately, when they come to me, we see a tremendous amount of side effects. Thyroid issues, hair falling out, triglycerides, LDLs going way up. Yes, I know you see the people on Instagram that are doing well. Okay, they might be doing well. I don't know. But again, it's very individualized. Your body might not be able to tolerate a keto diet. It's not for you. So.
But is it for some people, or is it bad? Because I'm gonna have to confess right here. That I don't think it's a good idea. I think you should have all the macronutrients and all the micronutrients, taken. But to take out one macronutrient, for me, it just doesn't make any sense.
That's a great point. And so I'm going to talk science and I'm going to talk research. The only scientific research done on keto diet is for children with epilepsy. And in children with epilepsy, it works. There is absolutely no other research done to show me that a keto diet is healthy.
Okay. All right. Just tell us a little bit about high and low glycemic index carbs, because people think if I eat carbs, I'm eating fat, so I'm gonna have my salad with a piece of steak instead, and I'm eating healthy now.
Right.
Although they don't know the idea that actually carbs is associated with water retention, and then actually you're losing some water along the way, and that's why when you start eating carbs back, you gain all that weight because it's water weight.
Yeah.
Right.
You've trained your body to never eat a carb, so now when you eat a carb, you're going to gain an excess amount of water weight. But let's go back a little bit. Let's rewind. Not all carbs are created equal. So we have the refined carbs that we know have absolutely no nutritional value, and they are detrimental to your health. What is a refined carb? It's white flour. It's white rice. It's white pasta. It's white bread. Those refined carbs have the fiber, have the nutrients, have the minerals taken out. There's bleach that's in them. They make them white and pretty, and then you ingest them. And how do you feel? It's like cocaine. You feel high, and then you feel a low. And that's what causes cravings and addiction. I want you to stop eating refined carbs. But here's what I want you to eat. I want you to eat your whole grains. What's a whole grain? Farro, couscous, whole grain bread like rye, like spelt, pumpernickel. A sweet potato amazing.
I know.
Jasmine rice, right? These are the things that we can absolutely incorporate in your diet. It's going to give you that energy that your brain works on. And you're not going to gain weight because we're going to do it in a controlled way. I'm not giving you a humongous bowl of white pasta. Big difference. Refined versus whole grain with the fiber, the mineral, the nutrients.
Okay. And those are the ones we should target.
Absolutely, especially for athletes.
Yes.